The new year brings little hope for people in Gaza. The United Nations has condemned Israeli attacks on hospitals, which it says have all but destroyed the healthcare system. Food, housing, and heating are all in short supply, and access to medical care is almost non-existent.
With most Gazans displaced from their homes and living in makeshift shelters, the weather only worsens the hardships they already face. Earlier this month, the UN Agency for Palestinian Refugees said that nearly 1 million displaced people were at risk this winter. It's not just residential tents at risk of flooding. Rising waters also affected the field hospital at the Nasser Medical Complex in Khan Yunis.
I came here for my son's treatment and found the hospital in this state. Well, you can see how it looks. It's not acceptable for any hospital anywhere else in the world.
Over a year of war in Gaza has left the medical system in tatters, with Israeli attacks reportedly killing over 500 medical workers, a number cited in a new report by the UN, which warns that civilians are at grave risk of going without life-saving care.
A report by the UN Human Rights Office has found that Israel's pattern of deadly attacks on and around Gaza's hospitals pushed the healthcare system to the brink of collapse with catastrophic effect. The report graphically details the impact of Israel's attacks, from the destruction of buildings and facilities to the killings of patients, staff and other civilians.
In Gaza City, there's a faint ray of hope amidst a worsening humanitarian situation, as one hospital reopens more than a year after it was destroyed by Israel. This comes as the last major hospital in northern Gaza shut down.
This opening comes while we are grieving the destruction and burning of Kamal Adwan Hospital and the destruction of the Indonesian hospital. This is our message to the world, that we are a people who deserve life, that our sick deserve to live.
In displacement camps, many describe this past year as their hardest, filled with loss and uncertainty. This past year passed and was a tragedy, and it's hard. We're hoping the new year will bring something better, though it's all unknown. Hour by hour, we don't know what our destiny will be. As a new year dawns, Gazans hold on to the little hope they have that 2025 will bring an end to the violence that has upended their lives.
Let's bring in Amande Bazerolle. She is Doctors Without Borders Emergency Coordinator in Gaza. Amande, can you tell us, how has 2024 been for the healthcare system in Gaza?
I think we all know that it has been terrible, and it's going bleaker and bleaker every day. Now there's 2 more hospitals non-functioning in the northern governorate of Gaza that leave us with less than 15 hospitals that are still remaining and partially functional in Gaza City at the time when the people are in very dire conditions and are getting sicker and sicker every day.
Now tell us, on the ground, what does the lack of health facilities mean for the people in Gaza?
We're relying a lot on the field hospital that some organizations, including mine, have been putting up. But even those, from time to time, have had to be evacuated because of a security context and the offensive on the ground. So the number of beds that are available for the people are really low now and not enough. And as I told you now, the winter has arrived, and as you showed on the pictures, it's very, very cold, and everybody knows now that there's already 6 babies that have died from hypothermia, and today it has been hailing and raining, and people are really flooded and very, very cold at the moment. So it's very difficult to be able to address all the needs at the moment, and the lack of medication is another issue.
Amande, stay with us for a moment. Let's hear from the UN Human Rights Office spokesperson, Jeremy Lawrence, who today spoke about the UN report that says Israeli attacks have destroyed Gaza's healthcare system, an allegation that Israel denies.
The protection of hospitals during warfare is paramount and must be respected by all sides at all times. In essence, if the relentless bombing and the dire humanitarian situation in Gaza were not enough, the one sanctuary where Palestinians should have felt safe, in fact, became a death trap. Under certain circumstances, the deliberate destruction of healthcare facilities may amount to a form of collective punishment, which is also a war crime.
Among the United Nations has consistently been issuing warnings about the dire situation of the health system in Gaza. Why has nothing changed?
That's a very good question. We all are questioning the same thing. For us, for example, we've been working in 16 different facilities that we had to evacuate because of targeting from the Israeli airstrikes. We had some incidents a few days ago, and it seems that there's not enough pressure on the international community to be able to stop what is happening on the ground at the moment. So we are kind of hopeless, and we're trying to do what we can. But we are taking a lot of risk, all our colleagues and us, trying to keep some health facility open when we know that from one day to the other we can be targeted as well.
Now, what could the international community do to help make the hospitals functional again as we go into 2025?
The first thing to ensure is a proper ceasefire. That's the only way that we can continue and rebuild the healthcare system at the moment. As I said, there's 11 field hospital at the moment, but it's just a plaster on a Band-Aid, and that's it. We cannot continue like that. It's still under tent. People are living under tent, and that's not the way it should be. There was a very well staffed and equipped healthcare system in Gaza, and at the moment there's no material entering to be able to rebuild any of those hospitals. And yet, even if we rebuild them, we're not sure they're not going to be targeted again. So everybody knows about Al Shifa Hospital in the northern part of Gaza, in Gaza City, that has been fairly demolished. And then the organization are trying to rebuild it from scratch because there's no capacity other than that one in Gaza City at the moment, when there is a lot of people that have been evacuated from the north that are arriving, and there's very few beds, hospitals that are available in that area.
Amande Bazerolle there from Doctors Without Borders in Gaza. Thank you very much.